Some of the key words that I would use to describe a nurse are caring, perseverance, passion, dedication, and innovation. I always tell my students, if you are a nurse, the sky is your limit.
Nurses are constantly identifying problems, things that might make people's lives better, and are innovating and creating solutions around that. If we think about the way that we can really unleash the power of nursing, I think it's giving nurses the resources and the leverage and the time and the space to be innovators and leaders. And that's how we'll really help solve healthcare problems.
The American Nurses Enterprise proudly represents the over 5 million U.S. nurses. And for 23 years consecutively, Americans have voted nursing as the most honest and ethical profession, which boils down to trust. As humans, we are hardwired to connect, and at the heart of connection is trust. It's the daily actions of nurses individually and collectively that's forged trust between our profession, patients, and the communities we serve. The broader value and skill of our profession is seen through our scientific rigor, use of evidence-based practice, technical expertise, and the deep caring nurses provide, which humanizes the experience of health. The American Nurses Enterprise Innovation Team is working to identify and amplify the ingenuity of nurses working to solve complex problems across healthcare and to scale nurse-led innovations across our country. The Innovation Awards are one way of making nurse-led innovations visible. Today, we celebrate the nurse winners of the 2025 Innovation Awards, but we also celebrate our profession. Congratulations to the 2025 winners of the ANA Innovation Awards sponsored by Stryker and in partnership with the American Nurses Foundation.
Hello everyone, what an honor and privilege it is to announce this year's ANA Innovation Award winners. My name is Scott Sachorn, Vice President and General Manager of Stryker's Acute Care Business, and I'm here with Becky Paulman, our Senior Director of Clinical Strategy and Solutions. We are both so excited to celebrate our 2025 winners. Your efforts in reshaping the future of healthcare are remarkable, and we are grateful to partner with such an inspiring organization.
Thanks, Scott. Our partnership with ANA continues to grow stronger, creating incredible opportunities for collaboration over the past few years. At Stryker, our mission is to make healthcare better, and we achieve this by innovating and working alongside our customers and valued partners like the ANA. Together, we are driving meaningful impact, and we are truly inspired by this year's winners and their dedication to advancing healthcare.
And Becky, this year, it's no surprise, the winners of the Innovation Award winners are really impressive. They're solving important problems, they're driving improvements across their field, and simply put, they're leaders who are making their mark on healthcare. Take, for example, Dr. Ramani Farag, who is tackling the critical issue of medication errors in K-12 schools. It's an area that lacks the funding that it needs. Her newly developed electronic school medication administration record verifies the right student is getting the right medication, and it even alerts staff and medication is missed. Our other winner, Dr. Sheridan Miyamoto and her team at Penn State also focused on a demographic that lacks the attention that it deserves. The safety system brings expert sexual assault care and evidence collection to survivors in rural and underserved suburban areas. Not only are both Dr. Farag and Dr. Miyamoto and their teams bringing much needed awareness to important populations across the country, but they're also advancing healthcare with innovative technologies that raise the quality of care for these patients.
Wow, Scott. I mean, truly a talented group this year. The innovation coming out of this award is energizing and showcases why our partnership with ANA is so important to us at Stryker. Innovation is a part of our DNA and is positively impacting the communities we live in. And we are so grateful for Dr. Farag and Dr. Miyamoto that they're focused on both with their technologies.
So congratulations again to the 2025 winners. Your accomplishments and your contributions are significant.
The name of my innovation is, the short acronym is eSMAR, which stands for Electronic School Medication Administration Record. My innovation is an electronic system to help school nurses administer the medication safely to children grades K through 12. The driver behind this is a lot of the research has been done focusing on nurses in the hospitals and to some extent in nursing homes, and no one is paying attention to school nurses. School nurses are doing a phenomenal job with a very limited resources. Because of my area of research around medication safety, I looked at some of the practices and best practices in the hospital system, and I modified it to fit the school environment. With this system in place, it alerts the school nurse if there is an error. This way, they can correct themselves and intercept the error before reaching the child. One day, I woke up in the morning and one of the school nurses texted me, "Amani, the system caught me. I made an error. I don't know how I made it." So she was so excited. Hearing all the positive feedback from the school nurses, hearing the healthcare coordinator for the entire district. Now I am piloting it with 4 schools, and she is ready to scale it to the entire school district. So this made me feel so proud. My advice is, do not accept the status quo if you are not satisfied with it. Just challenge it. Be brave to ask questions. Be brave to say no, this doesn't work. I have to fix it. I am a mother and a nurse. So I feel okay, if I can do something, why not? I cannot say that I know the next steps, all my road is clear in front of me. No. There are still some ambiguities. I still have some obstacles I have to manage. But I'm willing to do it. When I found that I won the award, I had a very bad week and I wanted something positive. I wanted a sign. And hearing the news that I got this award, I felt, yes, this is the sign that I shouldn't give up. I should keep going. So definitely this award will give a support for this and will validate the work.
My innovation is the safety system, which is the Sexual Assault Forensic Examination telehealth system. We partner in rural and underserved communities with nurses who are on the ground in front of someone who has come in, who has experienced a trauma, and we are able to support both the survivor and the local nurse to deliver really high quality forensic care in that moment. Sexual assault can be the single greatest threat to an individual's future health and potential. And yet 80% of individuals who experience sexual violence do not have access to a sexual assault nurse examiner or a SANE at the moment that they come in for care. And the consequences of not having great care can be devastating. I don't think that the public understands that if you were to go to one hospital, you might actually be able to see an expert if you're harmed. And if you go to another hospital, you may see someone who has no training in trauma-informed care and no understanding of what you've gone through. And that's a much different experience. The safety system helps patients feel safe. And we are bringing in expertise and pairing with a local provider, and together making sure that the patient understands their rights, that they have choice over everything that happens in the examination, and that we're meeting their needs in that moment. I feel most proud every single time we launch the safety system in a new community. To celebrate that the community has rallied, often generating resources to ensure that they're bringing this sort of service to their community. We worked with a senator in Pennsylvania who drafted legislation that was unanimously passed in the House and Senate. It's the Sexual Assault Nurse Examiner Act, to give hospitals resources so that they can either build SANE teams or access telesane programs such as the safety system. There were lots of things we didn't know how to do, but that was kind of the fun part as well, just being able to problem solve. And what I loved about my team was that We have a group of people who say yes before they say no, or at least say, I'm not sure how to do that, but we'll figure it out. That led to real innovation and some things that are remarkably different and gave us something that is easy to use. To future nurse innovators, I would say when it gets difficult and those challenges arise, dip into your nursing toolkit or gather new skills. But it may mean that we need to work with business partners, learn some of those skills, work with the communications team on how to message key stakeholders in a different way, make sure that our message is getting across. Recognition from the American Nurses Association is such an honor. I immediately went and shared the news with my team, and it just bolsters everybody's focus and reinvigorates the work.
Congratulations again to our winners, Dr. Sheridan Miyamoto and Dr. Amani Farag. And congratulations to all of the 2025 honorable mentions across every Innovation Award category. As you heard from our 2025 winners, the work of nurses spans the healthcare ecosystem. Nurses are ensuring access to care, promoting better environments for patients and healthcare professionals, which also includes building better products and technologies and providing critical services to every facet of our society. Nurses understand the nuanced aspects around care delivery, which ensures that safe, high-quality care is provided with positive health outcomes. Nursing is a powerful profession and our nation's most valuable healthcare resource. Nurses are uniquely positioned to design future-focused solutions for every aspect of healthcare. To all of you joining today, whether as a nurse innovator yourself or as an advocate for nurses, we're so glad you're here. We thank Stryker for sponsoring the 2025 ANA Innovation Awards, which amplify the innovative work of our profession. We see you and we thank you.